is that by and large, most people in medicine use a unified theory of science. So it doesn't matter whether or not someone is a medic, or someone is a psychiatrist, or someone is a surgeon. We all have the same basic principle, we all do the same training, we all then go on to do the same sort of construct of specialist training after we qualify. And that means that you know that if you're going to a doctor, if they are a bona fide doctor, they will have done 5 years undergraduate training and somewhere between 8 to 12 or more even specialist training to become a consultant. Or if they're a GP, they'll have done so many years GP training before they qualify to be a GP after they've done the medical training. As an aspiring medic in the Roman period, all you had to do was say to someone you're a doctor and you could treat them. Hopefully, what you had done is studied under another medic for a period of time, but there was no regulation, there was no royal colleges setting the bar for your medical training. So that could have been anything from 3 or 4 months to several years. And this is the great difficulty with what you get in terms of treatment. So it's always very dodgy. So some of those ideas like spittle, like sticking people in freezing baths to cure conditions or whatever would vary. So you never knew if you were going along to a doctor. Now some people would actually, if they were wealthy enough, hire a doctor, and if they treated them once successfully, then they might keep going to them. So it's in your interest to try and make sure you did get something from it. There's a bit of motivation there to do it, but it was all about money. And that's where it lies good so far, because this man here, he's unwell. So he comes along to me for treatment, and I said to him, right, I believe that you've got this disease. I'm going to give you some herbs, or I'm going to tell you to go and rub something on your head, or do this or that, and after day 3 you will have these symptoms, and after day 4 you'll have those symptoms, and day 5 you may get better or you may die. That's hedging my bets a bit. If he gets better, it's because he used my treatment. If he didn't get better, well, tough, you had that disease and there's not a lot could happen to you. So that's great, no comeback on me. Here we have the surgeon. So he's unwell and he comes along to me for surgery. Well, if he gets better, it's because I'm a damn good surgeon. But if he doesn't, it's my fault. There's no get out from that. And if he's wealthy enough to come to a surgeon, because he'd have had to be wealthy, chances are he's going to have someone who's got a lot of friends to back him. And so before you know it, he's suddenly coming to me, or his friends are coming along and saying, my friend Marcus died after you operated on him last week. I'm not very happy about that. Before I know it, I'm getting my head kicked in. So surgery was a bit of a risky side. So the majority of people who went into surgery, or who wanted to look at incorporating surgery into their training, would actually work for 2 main groups. Think about what they might be. The military and the gladiatorial schools, because you had a ready group of people who had injuries. Remember I said right at the beginning that you didn't have many opportunities to study the working of the body. So the sort of things you would treat surgically, somebody starts to become very ill, their abdomen's swollen. Now, nowadays what we'd do is we'd examine them, and if necessary we'd send them off for a scan, and then we'd find out they've got an abdominal tumour. Now the only way you're going to treat that is through surgery. But what did the Romans not have that we would have nowadays? More important than anything in surgery, an anaesthetic.
Yeah.
Unless you fancy me cutting your abdomen open to do exploratory surgery and have a good fertile round, chances are you'd be dead. So they would have no anaesthetic. So it was often very quick, rapid types of treatment. And it was mainly around things like trauma. So a lot of the instruments you see here are trauma-related instruments that you would actually see in a modern surgical setting. You would still see these things. This nowadays would be called a Langenbeck retractor. It's a bone elevator, so in a fracture, what you can do is get underneath the fractured bone to elevate it back into position. And this hook here allows your surgeon or a surgeon's assistant to pull this up to get it into position. And you'd still see something like this in a modern orthopaedic trauma set. Here you've got two types of tendon retractor, or for elevating a blood vessel. So if you're operating and you've got a blood vessel in the road, then you can just pull that blood vessel out of the road, or that tendon, while you're getting in. So again, very useful instruments. You've got an osteotome or a bone chisel, just like we'd use nowadays. You've got bone elevators. This you'd use for scraping the covering off a bone, the periosteum. Here you've got something see if you can recognise what it's for. What's the end of that? It's a saw blade, isn't it? Nowadays, you go cycling down the North Road and a juggernaut hits you. Before you know it, you're being rushed into the heath with a depressed skull fracture. So, what you would do is you'd be taken around to theatre, they'd make an incision proximal to the fracture, and then they'd drill a hole using something like a black max, which is a power drill. Roman times, what you would do is you'd have this and you'd use it, running it back and forwards. There's not very good grip on this, it's just ordinary wax string, and it would drill a hole in your bone.
It's a slow process, isn't it?
And well, yeah, it would grip, it would work better. And then you'd use something like one of, has it gone? It's moved again. Here you go. Carefully place this underneath through the hole in the bone, and there you've got your depressed bone, so you just push it up. And that's how you'd elevate a depressed skull fracture. That's how the Romans would have done it. Exactly the same I would do it. Only I'd use a power instrument instead. So there's no difference between that. In fact, when I one of the first neurosurgeons I went into theatre with many years ago, he wouldn't use a power drill, he used a bracing bit. You know, the old type of drill like that, because he believed it had better control when you were creating the burr holes in the bone. And he used that for many years until he came off his motorbike and died. He would have carried on using it until he retired otherwise. And it's something that there is no difference in the principle between how the Romans treated it to how modern medics treat it. So the surgery was actually very good. Biggest problem, as I say, with surgery was that lack of an anaesthetic. So,
and presumably infection, or were they quite good at?
Well, infections, some people actually did start to realise the problem with infection. Now, they didn't understand why, they didn't understand about bacteria, they didn't have that ability, but they knew that after injuries you would get infections, and they would give it various names, such as a flux or a discharge, and there was different ways of treating it. They didn't have antibiotics, but what they did have was topical agents, and some of the things that they would rub onto wounds to try and improve them sound a little bit strange, but arsenic. So what you would do is you would make ointments from various different herbs, and you could use arsenic, and they could make anticoagulant dressings. And one of the best ways of doing that is to use things like moss or even cobwebs. And if you think about it, if you ever visit any hospitals or you know anybody who works in hospitals, then some of the dressings that are used nowadays use a mesh that will actually bind on to help the bleeding, because the way that we clot, our clotting mechanism is the platelets suddenly increase in production when they're exposed to a particular type of protein that triggers production. That protein is produced as a result of trauma. That increases the platelet production, and it binds onto fibrin, which is sort of like these little strands in the blood, and the two of them bind together to form a clot. And that's how then the red blood cells get trapped into that, and there you get your clot. One of the great advantages is that whilst you didn't have hospitals in Roman society as a whole, that would have been down to someone wealthy enough to have a medic and attendants with assistants. But if you're in the army, then you would have had something equivalent to a hospital.
Because you've got a steady stream of people coming in.
So they became very adept in treating and cleaning wounds. So your orderlies in the hospital, much as nowadays nurses in hospitals, would dress wounds on a daily basis and more frequently, and observe and manage those and keep them clean. And they would also have had, the one thing you haven't mentioned, but obviously you've not been ill recently or had any injuries, but what's the worst thing when you get a really bad injury? If I came and stamped on your foot now, what would you do? It would hurt? Pain?
We're talking drugs.
So, medicines, yeah. Nowadays, if I did it, if you, well, I'm not going to stamp on your foot, don't panic. If one of us was to accidentally injure you, what sort of drugs would you take? Paracetamol?
She doesn't take much actually. She's very good.
You
very
got a
rare.
high pain threshold.
Very rare.
So if you get a headache, what's the commonest drug that you take?
Yeah, it's either paracetamol.
Paracetamol,
or
maybe Brufen, something like that. If it's a severe pain, you ever heard of something called morphine?
Yes, lovely. I had morphine when I had an emergency section. I liked morphine.
Yes, okay. Well, we'll keep you away from these then, all right?
Pain went away completely.
Yeah.
Because I said, can I go back for tea now? They said, no, you're having a child.
Yeah. You hear it?
Yeah, it's an arm.
Do you know what that is? Yeah. You'll see it. You've seen it. It's normally white or red. They grow wild if you leave them. Poppy seeds. The poppy, and Celsus, the Greek writer, Roman writer, again a name for your A star. Celsus wrote about everything. He wasn't a medic, he was actually a wealthy man who used to just think that he would show everybody how widespread his knowledge was by writing about everything. And the only books that are left of his that survived are his treatises on medicine. So it's very useful. But he talks about the tear of the poppy. And what they would do was they would boil, crush down the poppy, so all the seeds inside, they crush it down, boil it in wine so that the wine reduced, and then they could either mix it with something to make it into a thick paste, which you could leave to dry, and then you could cut that up, so they'd smear it out on a slab of slate, and then they cut it into little dried squares, so painted in tablets, or you could drink the potion, and it's known as the tears of the poppy, and it's basically a very primitive form of morphine. It's opium. No, you can't have it. So it's something that they would use as a pain relieving agent as well. But it costs, and that's the biggest thing. they didn't have free hospitals. Some cities, the city council might pay a medic to set up a free hospital, and there's some evidence that in Pompeii they actually had free hospitals. Not where you could go all the time, but perhaps 2 or 3 times a month or once a week, a medic would be paid to treat the poorer people. Much as we still had the free hospitals in the days before the NHS, but it wasn't very widespread, and you wouldn't have had them all over. So if you lived up in the valleys, you might have had a free hospital in Cardiff. I'm not sure if there was one. But the Royal Free in London is one of the most famous examples of that.